So I'm really happy to be here. By the way, as I'm speaking, feel free to stop by, get some carrot bisque or whatever, a green shot or whatever you like. You can come and go in as you please. And also, it's very informal. So I'm going to ask you to ask lots of questions, and I'm going to try to answer the best I can. There's also handouts, which make sure you don't leave without a handout. The handout is just a simple reading list, but also gives you access to where they have cooking classes. And of course, I don't need to tell you where you can come to eat some nice food, because we're standing right here. It's one of my favorite places to come. The diet, or the way to eat that I'll be talking about today, just to start out, first of all, it's called a whole food, plant-based diet. And to make a real short introduction to that, so on that diet, what you would eat is fruit, vegetables, and whole grains. And you try to really minimize your oils as much as you can. So that's what I'm talking about tonight. It's as simple as that. That's what the diet is. And I started out on this journey about 2 years ago. I watched that movie, Fork Over Knives. Many of you have seen it. And in that video, it said that you could reverse heart disease. So as a cardiologist, I thought, well, that's kind of interesting, you know. I don't see myself generally as reversing heart disease. We do a lot of plumbing work. But in terms of a primary treatment, and so I decided I would try out that diet myself, because how would you convince anyone to do something you're not willing to do? And so not only did I go out myself, but many of my patients and many of the staff at the hospital have decided to go on that as well. And I certainly became convinced in the last 2 years with my patients and things more largely. Before you just watch the video, but then you try it out in your own practice, your own experience, and getting tremendous results. And so that's some of today, just the excitement about that. So one thing I want to honor right away, many of you I recognize in the audience, many have already eaten vegetarian or whole food plant-based already, long before I have even, okay? So, you know, I put that out there as you can also, I hope you could share some of your own experiences and things. One of the things that I wanted to mention up front, because things we hear commonly is, you know, I would be concerned about, you know, is it going to taste good? That's the first thing out, because I consider myself sort of a foodie, you know, I love good food. And so a lot of the slides that I brought are just pictures of things that I ate, you know, things that I cook. But it's really to try to convince you that the reason you eat this good is because it tastes better, you feel better, it helps prevent illness. I'm just going to show a few of the slides. We don't have to get through all these at all. There's just something, mostly I just wanted to engage you and talk to you. But first of all, I just want to talk a little about what's called diseases of excess. And that's diseases where diet is the primary cause of the problem. Diet is the cause of the problem. And of course, preventing any illness, exercise, not smoking, reducing stress, all these things are helpful. But diet is probably, of all of those, probably not smoking is the best thing you can do. Aside from that, a proper diet is going to make a big difference in preventing illnesses. So, this is something that I cooked for breakfast for my daughter many years ago. But you can see it's just a typical bacon and eggs and toast and all kinds of things. But this is up here, a list of illnesses associated with these so-called diseases of excess. Heart attacks, hypertension, obesity, strokes, osteoporosis, diabetes, constipation, diarrhea, diverticulitis, gallstones, hiatal hernia, breast cancer, colon cancer, prostate cancer, just to name a few. All these are associated primarily with eating meat. wheat and dairy in particular. Next slide. So this is from last year, slide from last year. So this is the first time in history where in the United States, I'm talking about now, we're mostly overfed and malnourished and sicker and heavier than ever before. So a lot of that, when you talk about healthcare reform, is what are we going to do with the burdening costs and all these things. Most of these diseases, about 80% of them, about 80% of what we're spending our money and time and misery on and things that could be changed primarily through diet. Okay, here's the 10 leading causes of death. Heart disease. Heart disease is a foodborne illness. It has to do with what we eat. And cancers, stroke, these are all a list of most common illnesses. And the only ones that are not related to diet is influenza, accidents, and suicides. So these other things are affected by diet. Next. And then an updated list shows that actually the third leading cause of death in the United States is medical care. Unnecessary medicines, unnecessary surgery, hospital errors, hospital-borne infections. So if you're going to the hospital, you're taking a risk as well. Next slide. Next slide. Okay, in the United States, breast cancer is really epidemic. Every 15 minutes, a new diagnosis. Every 12 minutes, a death. And I don't think you can really walk around in the world now and not know someone that you love, or a friend, or someone else that's suffering from breast cancer. And we see that this obesity that we're dealing with hasn't always been the case. It's actually an epidemic in the last 10 years, 15 years. Next slide. This is just a slide taken at the library of all the books on diet. So this is as the lay public has to choose from to try to figure out what diet is good. Here's just some of those books that you pull them off the shelf. Atkins, cabbage soup, all kinds of things. The one thing I wanted to say that most of this diet was worked out by Dr. Colin Campbell. He's a professor at Cornell University. And one of the things that he has been writing about and editorializing about is nutrition is not based on one factor. It's not like, boy, if you just eat red berries, that's the secret to good health. Or if you just eat this, that's the secret to good health. What he's really saying about food is, it's kind of like a symphony. It's a melody of vitamins and minerals and things you need all to get proper nutrition and to make all your... Actually, nutrition is fairly complicated. That's why you need a diversity of things in a balanced way. But what do we end up eating? Junk food. There's $10 billion in advertising. I haven't seen any advertisement for kale yet, broccoli, and hard. So $10 billion, that doesn't affect me. It doesn't fool me. As you know, advertising is very powerful, very powerful. And it's just, now here's talk about confusion. Here's a billboard, prevent childhood obesity, and then right below the billboard is for McDonald's. All right, next slide. And this is what we're mostly eating. So refined and processed foods, 51%. So when they're refined and processed, what's basically being put into them is a lot of sugars, a lot of processed sugars, a lot of corn oil. And so we always say if it comes from a plant, don't eat it. But if it is a plant, do. Because the food is put through these plants and it's just a bunch of processed stuff, so it'll stay on the shelf for a long time. And basically try to give it some salt and some fat taste so it'll taste palatable. And a lot of dairy there. Now, so you saw we're eating a lot of processed foods, a lot of sugar, a lot of animal protein. Working through this. So these are the countries on the bottom here. So this country, Laos, in green is percentage of calories of unrefined food. In other words, in that country, they're just eating, they're growing things and then they eat them. Where in the USA, we're eating percentage of, in green, mostly processed food. In red is heart disease. So you see, the more processed food, the more heart disease you have. And when you go down here, these countries, they're not eating processed food and they don't have any heart disease. So, as I talked about earlier, the diet I'm talking about is plant-based, 10% fat, whole grain. Now, the evidence is regarding heart disease, it helps prevent heart disease, but also helps reverse heart disease. And what's reversing heart disease? That means I have a patient, take him to the cath lab, do an angiogram, look at his arteries and see if there's a blockage in the arteries. Then they go on a whole food plant-based diet, they come back to the cath lab a year later, they no longer see any blockages in the arteries. That's what reversing heart disease, that's what I'm saying. Now we see blockages, then we go back and look, they disappear. By eating like this. Similarly, this type of diet has been shown to reverse diabetes. Not treat diabetes, treat it in the sense of reversing it, meaning when you go on this type of diet and your sugars start to fall and then you have to lower your medicines, eventually you may have to get off your medicines because it's working so effectively. So scientific medical literature supports that diet surpasses results achieved with any drug surgical therapy. Diet has had more effect than any kind of operation, any kind of bypass surgery, angioplasty, medicines, statins. Diet has more ability to do all that. Next slide. This is kind of what I said before, things that it does for you. Okay, let's go. This is a little bit, we'll go to the next slide. Okay, one of the things to talk about, the reason why eating this way is helpful, because if you're eating vegetables and you're eating fruit, it's not very dense in calories. So I never really have to worry if I'm in the kitchen and I'm eating. I usually shred some carrots and some kale, put some vinegar on it, eat that a lot during the week to really enjoy it. But I don't have to be careful. Oh my God, I ate too much of that carrot salad. Nothing bad's going to happen to you. So that's kind of fitting for me. Has anyone in the room ever had any problems with like eating too much once in a while, or compulsive eating, or you feel like you're attached to food? It's good to eat on a plant-based diet because rather than go through years and years of therapy and trying to figure out why, as a human being, you desire to eat, is because you can eat a lot of healthy food and not worry about that. And then you start to realize that I'm just eating a balanced way. So you have to address some common sense on in terms of proportion and get going at. But the reality, when you're eating on milk and dairy and plant side, it's so nutritionally deplete, but so calorie dense that you eat very little and you're way over what you should eat. Next slide. And this is by way of example. So just to look at this, right up here, this is animal food, plant food. So there's no cholesterol in plants. Look at this protein, same amount of protein in plants and animal food here, same amount, in case you're worried about the protein. Now let's look at beta-carotene. 29,000 units, but in animals, 17 units. Huge difference in nutrients. And what am I saying? What am I comparing here? In the vegetables, it's tomatoes, spinach, lima beans, peas, and potatoes. And then equal parts beef, pork, chicken, and whole milk. That's what we're comparing in terms of just basically meat versus vegetables. And you can see that nutrition, all the nutrition and vitamins are in the plants. And all the calories and the fats in the animals. Next slide. So let's look how this plays out. You can eat a half cup of gummy bears equal 2 pounds of pineapple. In terms of calories. Of course, there's no nutrition in the gummy bears, it's just sugar, processed sugar. And a pint of ice cream compared to a raw salad, corn, baked potatoes, and a pound of cherries to make it. So you see the big difference in calories. Come right in. You see the big difference in calories and nutrition. That's what I'm saying about eating. Come right in. Come right in. No problem. Big difference in what you're going to eat. So next slide. Next slide. Okay, this is just a picture of the nutrients in spinach. This is all the nutrients that are in spinach. It's not all of them, it's just some of them. All the nutrients in spinach. So it has all these healthy things that are really good for you. Next slide. Okay, this is just talking about high fructose corn syrup, which is basically just you take corn and you take all the protein out of it, just take the sugar and process it down, and then you put it in as a sweetener in all these foods, and then your body can't tell high fructose corn syrup. It doesn't tell you that you're full, so you just keep eating more of it. It's in everything. You gotta read the label, it's in everything. It has no nutritional value at all. You may have seen that article in the Kenosha News about an article of John just last week talking about eating processed sugar to the risk of heart disease. Just even with one soda, increasing the risk of cardiac disease, just by having one soda a day. Just because you're eating processed sugar. Next slide. This is just the relation between your weight and your chances of dying. Next slide. Next slide. These next slides are just saying that the more weight you have, the more chance of diabetes, the more chance of hypertension. Next slide. And the more chance of heart disease. Next slide. Now, let's look at this a moment. This is just showing the relationship between saturated fats and dying, in particular heart disease, in particular all the animal fat. So it's a direct correlation based on what countries they eat. Next slide. Okay, this is just a slide that came right out of the China study, which is in the handout if you want to take a look at that book. A lot of the things, that's a book that totally influenced me in understanding why to eat this way. But Dr. Campbell, who did this work, really, Dr. Campbell, he started out as a dairy farmer. That's who was his family, were dairy farmers. And he went to the Philippines because he wanted to figure out a way to have people who were nutritionally starving there, calorically starving, to increase their calories so they would become healthier. And he, of course, as a dairy farmer going down there, you think, boy, it must be dairy, we got dairy substance, we have like dairy to keep people healthy. That's how he grew up, that's how he was trained. But when he went down there, he noticed that people who were at the upper income level were eating more animal protein, and they were seeing liver cancer in the children who were eating animal protein. So he's like, boy, that's kind of strange. And there was some earlier work in India that had demonstrated the same thing in animals. So this is his work in animals, feeding animals. They would feed them 20% protein diet, and then they would expose those animals to a carcinogen. And so the animals that got 20% protein diet, they then would do autopsies and find cancer. And then animals that were fed 5% protein diet, they didn't have the cancer. And then he would take the same animals and turn them diet and modify it. So if you're at 20% and you go to 5%, your cancer went down or went away. And then if you went back up to 20%, the cancer went up again. He was finding that by adjusting the protein in the diet between 5 and 20%, he could turn cancer on and off. Next slide. Well, after that, he hooked up with, it turns out the premier of China had cancer, and so they initiated a study to look at all the cancer deaths in the country, and they made a big map of it. You know, it's a huge undertaking, nearly 800,000 people working on it. And then when the premier says you're going to do something, you kind of do it. So that's really how that happened. And what they did was make a map of China that showed all the cancer deaths. Dr. Campbell then went back and took blood tests and urinary tests, interviewed extensively on people's diet, and after that, they made the correlation between diet and other illnesses, such as heart disease and cancer. So, people that were living in rural China were dying of these things: pneumonia, parasites, rheumatic heart disease. Where people that ate more protein or meat had cancer, diabetes, and coronary disease. Next slide. This is just a slide showing that if you eat dietary animal protein, and you look at the countries that eat a lot of dietary protein, the risk of fracture, hip fracture. So the more dietary protein you're eating, and animal protein in particular, then the higher risk of a bone fracture or osteoporosis. Next slide. Just looking at the incidence. This is breast cancer. Total fat intake. Where's the chance of getting breast cancer? So the more the total fat you ate, the higher risk of breast cancer. And one thing to say is that this line goes, the correlation is stuff that goes all the way down. It doesn't, so if you eat almost no fat, you almost no chance of breast cancer. Animal protein. Next slide. Okay, now here's the graph that shows eating plants, no animal protein, versus the incidence of breast cancer. So if you're not eating animals or dairy, then you can see the incidence of breast cancer. There's no correlation really. It's just scattered all over. There is no single line, like you saw in the previous slide. So, plant fat is not associated with breast cancer, but animal fat is. Okay. Next slide. Now, this is the Nurses' Health Study is a very famous long-term study, looked at many things. And so you just saw how, wait a minute, okay, if you don't eat animal protein and animal fat, then you don't get breast cancer, but if you do, you do. Now, in the Nurses' Health Study, we can see that this is eating more, increasing animal protein and decreasing fat. Okay, so if you look at this, there really was no correlation between fat and breast cancer in the Nurses' Health Study. Like, well, that's saying the opposite. What are you saying? That's saying the opposite, because when they looked at that, they looked at nurses over 80 years and correlated the amount of protein they ate with breast cancer. And there wasn't a good correlation. And that's the reason for that is they asked the nurses to eat a low-fat diet. When they ate a low-fat diet, then they ate more low-fat yogurt. Okay? They ate a lot more animal protein, but they didn't eat more fat. So the reason there's no correlation is because they're eating still a lot of animal protein, as opposed to just eating plants. So what the nurses study, they act like there is no correlation between fat and breast cancer. But when you look at it closely, people eat a low-fat diet are eating more animal protein. They're still eating animals, and that's why they still have breast cancer. Next slide. So this is what the nurses were eating when they were told to eat no fat. They're eating less red meat, more chicken and fish. No change in vegetables or legumes. So they had less fat, but they had more poultry and fish. They're getting animal protein, and that's why they still had breast cancer. Next slide. So this is just looking at that initiative. If you see when they told them to eat low fat, they're getting, in terms of animal protein, they're getting a similar amount because they're eating more yogurt and things like that. So I just bring that up because if you look at even like today, in terms of even the American Cancer Society, look at breast cancer. I mean, who's sponsoring the breast cancer runs? Yogurt. Yogurt is animal protein. It causes breast cancer. It's highly associated with breast cancer. So, you know, it's kind of corporately taken over. I'm just trying to show that really what makes a difference in terms of preventing breast cancer is to eat vegetables. Don't eat meat, don't eat milk, don't eat protein. Yes?
Can you talk a little bit about vegetable oil?
One of the things I want to talk about, the question is about what about oils, and vegetable oil in particular. So, I actually use a number of authors who don't always agree on the same thing, but the authors, what they do agree on is eating plant-based is healthier and prevents a lot of illnesses. My question comes up about oils. So, in Dr. Esselstyn, who's in Fork Over Knives video and things that he promotes, he did a lot of work on reversing coronary disease. And he recommends not using any oils. No oils. No vegetable oil, no animal oil, olive oils. And there's a couple of reasons why. The patients that he followed that had coronary artery disease, had previous bypass, had a lot of events. When he took out all the oils, they didn't have any events. So he's just saying, well, this is what I did with these patients, and this is the results, and look how good they are. Others allow some oil in the diet, but I think if you're trying to reverse diabetes and heart disease in particular, it's better to try and use no oils. And then you know, the thing about oils mostly is that they're very calorie dense. Very calorie dense. So if you're trying to work on your weight and control that, you're eating a lot of oils. If you think about it, in order to make that olive oil, how many olives have to be crushed to get a whole bottle? And it's lots in that one bottle. So if you're using a lot of that, you're getting just a lot of calories. Aside from the fact that the works that have been done in reversing heart disease, reversing diabetes, is done on not eating oils. Okay, next slide. This is just talking about the effect of it had on women in particular. When they don't eat animal protein, then they have, or this is actually when they do eat animal protein, at early age of menarche, greater body weight, higher body fat, which is probably because they have early menarche, they have a longer exposure to estrogen, which is a risk factor for breast cancer. So it's probably one of the mechanisms of how it works. Next slide. Let's go to the next slide. Keep going. Keep going a little bit, okay? It's all the things exercise does for you. In terms of exercise, it'll help with diabetes, help with depression, help with reverse breast cancer, colon cancer, heart disease, stroke, anxiety. Okay, next slide. And next slide. This is just some data, but eating animal protein is also associated with kidney stones. I want to talk a little bit about osteoporosis in a plant-based diet, and kidney stones in particular. So what happens is when you eat meat, when the meat is digested, the amino acids that are in the meat in particular, when they're digested, they cause an acidosis in the body. In other words, it makes the pH a little more acidic. And the body always wants to have a perfectly balanced pH because that keeps all the enzymes working and such. And so in order to make the pH right where it should be, all it has to do is take calcium out of the bone. And the calcium is a buffer, and that will correct the pH. So if you're eating dairy and animal products, then you're going to pull calcium out of the bone to prevent acidosis. If you pull calcium out of the bone, you're going to be more prone to osteoporosis. If you pour calcium out of the bone, it's going to come out in the urine, and you're going to, it'll make crystals and form a stone. So if you eat plant-based, it doesn't make you acidotic. It doesn't pull the calcium out. It's not associated with osteoporosis. It's not associated with kidney stones. And so you can see kind of the connection there of if you have kidney stones, why you don't want to eat meat or dairy, and osteoporosis. So think about that. A lot of treatment for osteoporosis to try to have you take calcium. Eat calcium, you know, eat more calcium, eat more milk, eat more animal protein. It's going to make you more acidotic, it's going to pull more calcium out. Calcium won't be absorbed. So the best thing if you want to prevent osteoporosis is don't eat dairy, don't eat meat, eat animal protein, because that's what makes the acidosis that's making the problem. Next slide. That's where we get the same evidence of hip fractures. It's just whether you're prone to osteoporosis, that's why you're fracturing your hip. Next slide. Okay, so one thing I wanted to talk about is, okay, eating plant-based. So what about the food pyramid? Wait a minute, I just said all these things, but if you look at the USDA food pyramid, it says you should have some meat every day and some dairy. There was a doctor that sued the USDA. It took him 2.5 years in federal court, and he won in court because he was able to show that people who made the food pyramid were on the take from the dairy industry and the meat industry. So if you want to take nutritional advice from people that are being paid by the industry to sell you these things, that would be one choice. But I think Dr. Campbell's work and the other doctors that did this work, who are nutritionists, saying, this is where you are in the food pyramid in terms of the amount of protein you're getting in the food pyramid, 35%. If you eat plant-based, you're only getting 10% protein. You only get 10% protein if you just eat vegetables. The good news is that 10% protein supplies all your needs. These people that are eating according to the food pyramid are getting 35% protein, and that's why it's associated with coronary disease, osteoporosis, cancer. The protein is turning on your genetics that make cholesterol, and turning off the genes that fight cancer. So the food pyramid is not a balanced thing. Now, when I say you need 10% nutrition, we know 10% protein in your diet. We've known that since about 1910. It's not even controversial. So the most common thing you hear if you eat this way is, oh, well, where about your protein? We're going to get your protein. The problem with eating meat is you're getting too much protein. You're turning on all the genes that are causing these chronic illnesses. That's why we see in the epidemiology study. So, if you think about it, protein is, when you eat meat, it's a complete protein. It has all the amino acids you need to make muscle. So that's why it got so much value in society. Wow, you know, this is a complete protein. I'll just eat this. I don't have to worry about anything. I'll get all the protein I need. You will, and then some. They're called the illnesses. Or if you eat a plant, it's not a complete protein. It doesn't have all the building blocks. But if you eat a variety of vegetables, you'll get 10% protein, you'll be able to do it. Yes?
So exactly, like with muscles, you know, you want to increase your protein if someone wants to bulk up. So if you were trying to eat more plant-based, which vegetables would you recommend?
So, we start here.
Like peanut butter, you know, I mean.
So the thing, what I'm getting at is, your protein needs are so low that you're not going to be protein deficient. There's only one way. I've been practicing physician for 26 years, and I've not seen anybody come in with a protein deficiency in the United States. Ever. Now, they can be protein deficient if they're calorically deficient. In other words, they're not taking any calories. Someone who is starving, they'll be protein deficient, yes. But as you saw earlier, no one's calorically starved, unless they're by themselves or have a mental problem. I mean, no one's coming in because they're not having enough protein, even though that's the protein drinks. Which, by the way, the FDA is closely looking at them. They're probably going to be banned because they have a lot of associated cardiac problems aside from racing heart attacks. I mean, the protein drinks are dangerous as anything. But why are we taking protein drinks? Because you're going to have plenty of protein just by eating plants. It has all the protein you need in a more balanced way, and then you're not going to get too much. You don't have to worry about eating this or this to get enough protein. Next slide. This is just, gotta go on forward. This is just talking about, this is a normal heart artery, and this is all the plaque inside the artery. And so it has blockages in the artery. Next slide. Just go back one slide. Just on that graph. Yeah, go back one slide. Okay, this is just, I just want to point this out. So every war we've ever had, going back to Vietnam, and all the wars since then, young people that died from the war, from mortalities in the war, they did autopsies on them. Already, people 20 years old in this country have atherosclerotic plaque inside their arteries already. So, and that's been true for war after war. So the point is that from eating this diet, from atherosclerosis starts in the heart when you're young, but from eating all this animal protein and such. Next slide. This just came out of that movie, Fork Over Knives, and then you have seen it. But what it's saying here in Norway. This is the death rate due to heart disease, okay? And then in 1942, you see a sharp decline. Just want to ask you, were statins, that drug we use, is that when statins were invented to see such a remarkable decline in coronary disease? No, statins weren't invented yet. That was during World War II. In fact, that correlates with when the Germans took over Norway and took all the dairy and all the meat away from the people of Norway. And then and they used it all for their army. And then heart disease disappeared. Why did heart disease come back? The Germans lost the war. The people of Norway got their beef and milk back. Just a little correlation that we haven't seen anything this powerful in medicine that could reduce heart disease like that. Next slide. But people in Norway were forced to eat a plant-based diet. Next slide. Okay, I just want to talk about diabetes for a moment. So here is someone's blood sugar. 250, 200, 150, this is the normal range. And this is when someone started a plant-based diet. And this is the blood sugar in the normal range. When I want to show you this is at 10 days. 10 days. So the reason a plant-based diet and not eating oil, not eating meat or dairy helps diabetes so much. So if you go to most doctors, 99% of them, you go to American Dietetic Association, American Diabetes Association, basically what they're going to counsel the patient is say, when you eat, you can't handle sugars. So I want you to eat a little bit of protein, a little bit of fat at every meal. That way you won't get too much carbohydrate. And then your sugars won't be high. And you know what? That's absolutely true. If you can't handle sugars, you should limit your sugar intake so your sugars don't go high. It happens that way. That's a correct statement. But the other part of the statement is, if you quit eating animal protein and you quit eating dairy, then your insulin starts to work. patients that have type 2 diabetes, they have plenty of insulin. It just doesn't work. So when you quit eating animal protein and fat, then your insulin starts to work. And then, after about 10 days, then your sugars will start to go down and go off your medicines. And then your diabetes becomes reversed, meaning eventually you don't need your medicines. It takes time before you get off all the medicines, but nonetheless. So, if you're just up in here and you're just taking medicines, you're not reversing the diabetes, so you may control your blood sugar, but you're still going to have the risk factor of heart disease and all the other complications of diabetes. But if you eat a plant-based diet, you can get rid of your diabetes and the complications associated with it. Yes?
You were discussing that dairy protein has the effect of inhibiting insulin from working.
Yes.
What is the mechanism for that inhibiting factor?
What happens when you eat dairy is it turns on the genes and increases something called insulin-like growth factor. And so it's changing your receptors, you know, so your insulin, you have plenty of it, your receptors don't let it in. So by eating differently, getting rid of the oils and the meat and the dairy, your receptors change and now your insulin starts to work. So this is a dramatic thing. And one of the reasons, so I'm getting at, wait a minute, he's saying he's reversing cancers, reversing diabetes, reversing heart disease. Why is one diet doing all these things? You don't even have to buy my book, you don't have to do the program, you don't have to get the tapes, you don't have to, all you have to do is eat vegetables, fruits, and whole grains, that's all. There's no secret to this. Next slide. This is just the amount of usual diet, the amount of calcium in the urine. Plant protein diet, not much calcium. That means if you don't have calcium in the urine, then you're not getting osteoporosis, you're not getting kidney stones. Next slide. Next slide. Next slide. Go on. Are we back to the start? Can you switch over to the other? Yeah. Oh, there we go. Watch that. Let's go through here. I'm just going to show you pictures of food for a moment. First, we have fruit. This is just like a noodle soup, vegetable broth, orange, carrots. The reason I'm showing you this is because these are just pictures of things that I ate. You can see strawberries. You need strawberries in the diet. And this is bulgur wheat with some greens grown in the garden. I'll put it in a big salad, take it to a party. Next slide. This is kale I grew in the garden. So look how big that is. Wow, man, they're going to eat a lot of kale. Next slide. There it is. It just boils down into a dish and then some beans with it, a little balsamic vinegar. Yes, sure.
What do we talk about B12?
Good. So one of the things, if you're going to eat this diet, what should I be careful of? And is there someone that can't go on this diet? Okay. The one thing you will not get enough of by eating just plants, right, and the way I was talking about is B12. B12 is made by bacteria. And the reason it's in meat is because it's in the colon of the cow, and then the bacteria makes the colon of the cow absorb into the meat. But so it's not in plants, or fruits, so you got to take B12. B12 is a serious thing because it can cause neurological problems, cause serious anemia can cause. But taking a simple supplement is all you need to do. And B12 is not toxic at any level. There's no too much B12. You can get it from nutritional yeast, which is a lot of people that are vegan eat nutritional yeast because it tastes kind of like cheese, it's got a good flavor. It has B12 in it. Or you can take a supplement. No. Next slide. That's just kale, so to try. Or that's made of kale chips. That's kale that grew in the backyard. That's the one I have close to the house. It's my emergency kale.
Would you agree that most people that try to convert to a plant-based diet aren't careful enough about sodium? Aren't careful enough about sodium. It's like a common, you can get overconsumption of sodium and everything.
So the question is about sodium and eating plant-based. So one of the things about eating plant-based is, you know, as one thing I should say up front is in general, you're going to be buying vegetables, chopping them up yourself, saute them in some vegetable juice. Make a lot of stuff yourself. Don't buy processed vegetables or if you have to buy something like that, buy frozen better than canned. Cans full of salt. And so the other thing is when you cook, what I do when I cook, if I'm going to add salt, I add it at the table. So it's right on top of the food, and you can taste it more. And if you have to put a lot more salt in if you're making something while you're cooking it. And what will happen is you eat less salt, because we're all getting way too much salt. If you eat less salt, then your taste buds will gradually change. And I make the analogy, if you ever had whole milk and then you go to 2%, and then you go to 0%, you're down to 0%, well, it tastes like water. And you go back up to whole milk, like it tastes like oil. Your taste will adjust for both sugar and salt and fat as well. You get used to it. Yes? Okay, nuts. It's a good one, nuts brought up. So one of the reasons nuts are good for you, and they have a lot of omega-3s in them. And they have other things that are helpful. There's some evidence that eating nuts helps prevent breast cancer. The thing about nuts is they're very calorie dense. So can you eat nuts? Yes. How many? Well, not that many. Just because of the calories. But let me get at a part of nuts, get this as omega-3. Some people eat fish because they say, well, it's got omega-3 in it. So the reason we want to eat omega-3s is to counterbalance omega-6s. Omega-6s promote inflammation that can cause heart disease, arthritis, other illnesses. Omega-3s decrease inflammation. When you eat animal protein, you get huge amounts of omega-6s. So the thought was, well, then we'll just eat a whole bunch of omega-3s and counterbalance it. But normally, if you just eat vegetables and things, you're going to get a perfectly balanced amount, 1-to-1 ratio of 3 to 6s. So you don't need 3s because you're getting 3s in the vegetables. To give you an example, how much omega-3 do you need daily? You can get it in one walnut, has all the omega-3 you need. If you're not eating meat. The point is, it's like you're eating massive amounts of these omega-3s, these very calorie-dense things. Oh, I need my omega-3s, it's heart healthy. And what you really don't want is omega-6s, which you get in meat and things. So, yes, omega-3s are good, but kind of like protein, you don't need much of it. You'll get it naturally just by eating it.
Can a plant-based diet cause someone to have low vitamin D?
Vitamin D? I don't think a plant-based diet will cause that, but we're in a climate, just because of lack of sunshine, where vitamin D deficiency is very common. So the best thing to do is to check your levels and see if you need it or not. You want to have a normal level. So if you need vitamin D, you should take it. You're not going to be more prone to it by not eating meat. It's just most of it has to do with sunshine. And it's a very complex process, but B12 and D are levels that I check and try to keep those levels normal. All other vitamins you will get everything you need just by eating plants. So much so that there's a lot of evidence now all the supplement vitamins, aside from B12 and D, are not really helpful. Yes?
I have problems with grains. I'm trying to be vegan. Mostly vegan now. I know there's bad grains, but is there anything you can recommend if somebody has problems digesting some beans and some grains?
So some people can't take grains, wheat in particular, if they're gluten sensitive. And there's a lot of people are gluten sensitive, and then a lot of people are sensitive to gluten if you test them, but they haven't manifest yet in terms of illness. So you definitely, if you are gluten sensitive that way, then you're not going to be able to eat as much grains.
So what is
Or
the,
wheat in particular.
what nutritional do we get from grains? I mean, what's
Well,
important? Because I don't think it's that important.
No, I think the grains are very good. And a couple of things that you get from, the reason I say a whole grain, if it's not a whole grain, then you're taking off the fiber, you're taking off the protein part, you're taking off most of the nutrients. You're just left with the sugar part. And so, for instance, if you're just eating the old Wonder Bread, they take everything out, and then just have this really white bed, and then they try to put all the vitamins back in it, and then tell you to build strong bones 12 ways, because they put 12 vitamins in it. The point of it is that if you just take the whole grain and make some bread, then you've got a lot of fiber, you got a lot of protein, you got a lot of nutrient in that, and that fiber is particularly helpful in preventing heart disease and a lot of these illnesses, because the more fiber you take, the less chance of colon cancer, heart disease, and a number of illnesses.
But don't you get the fiber from the vegetables?
Yeah, and there is fiber.
So
in
there,
vegetables.
what's a nutritional factor? Because I'm just thinking that grain's not that necessary, so I'm just trying to figure that out.
Well, I think if you can't tolerate it, I understand that, wheat in particular, but the one reason you might want to have grains is because you'll enjoy it.
Oh, it's about satisfying, okay.
It's going to help with your appetite, it'll help with your absorption, it'll help prevent these illnesses, and it has nutritional value. And it increases your repertoire, what you can make and eat with it. Now, what I like to say, whole grains, I just kind of take it real literally. I just buy the grain, soak it till it softens up, and then I can mix it in salads or cook it till it's a little bit chewy, or whatever consistency you want, and then you can put it in things. So a lot of it is, when I say whole grains and I buy it, I can see the grain and see what it looks like. And then it's also the cheapest way to buy it. You can buy it in bulk and have it, I think for me, if you're able to eat it, it adds a lot of value, it adds a lot of fiber, it adds a lot of variety of what the way you make things taste. Yes?
How do people transition from our
I'm glad-
diet to that?
I'm glad you asked that question.
Yeah, that's the
So-
lifestyle.
Yeah. First thing I would say is, and particularly people that eat this way, then you're around other people, you're around your family, and then you're the weird one. And you're, what? What? Can you eat this? Can you eat that? What? And then they become concerned about you. So the thing is, what I concentrate on, something like that, is I just remember, I would say it took me about 55 years to come to this conclusion, even with all my mistraining as a doctor and everything else. So a lot of it is to realize that the rest of the world's not going to be used to it. But that being said, the reason to go on it is because you come to realize maybe you're not immortal, or you don't feel well, I need to make some changes. I start to see the data on this. You start to look at how animals are raised, and maybe a multitude of reasons why people come to that conclusion. My own feeling is the more you just go on it as much as you can immediately, then you will feel the effects more. If you go on it gradually, then it's hard. But if you go back to this, if someone's blood sugar coming down in 4 weeks, if you look at people that promote these diets, most of them say, take the 4-week challenge. Because they know that you're going to feel better that quick. You're going to feel better that quick, and that'll make you want to stay on it. So there's no reason you can't work your way toward it, like anything else. You can work your way toward it. But I would say the sooner you do it, the more you feel it, the more you'll be motivated to stay on it. And that means that be easy on yourself. Because it's not a religion. All my patients think they have to call me up to confess that they ate something. So what if you went off the diet? Okay, then just you can go back on it too. You know, don't give yourself time, because actually part of preventing heart disease and its illnesses is to be gentle on yourself, be more meditative, be happier, let those things happen, which the diet will encourage you to do. So the faster you're on it, the happier you'll be. Probably in my own perspective, the only thing I would say in retrospect, I wish I would have had more insight earlier. I would have liked to have been on it longer. That's just because you feel well. I'll tell you my own experience, because having a number of patients that decided to go on the diet before, they used to come in and, I'm having this shortness of breath, I'm having this chest pain, I'm having this or that. And then they went on the diet completely, then they came back. In a relatively short time, 2 or 3 months. When they come back, they mostly just keep talking about recipes. And then usually it's an awkward moment, they bring up, should I be farting this much? I know they're on the diet. They're getting more bulk that way. It's just a healthier thing. So I would say, however you want to go on it, but I think it's actually easier on you to try to embrace it as much as you can. Now, one of the things that I would say about going on the diet, the most important thing is go into the pantry, look in the refrigerator, look at what you really don't want to be eating anymore. Because if you're like anyone else, you come home, you're tired, or this or that, and so you're just going to grab something that's there at convenience. So a lot of, I think, going on is transitioning into your pantry or refrigerator. What fast food place you're going to come to, you don't want to cook, stop in here. You'll have the chili, have anything you want, Yeah. So, I mean, it's very helpful.
I was going to say too, here at the cafe, we're a resource for anybody that wants to transition. I've been vegan for 5 years. I've been vegetarian since college. I won't say how long that's been. So I've transitioned slowly to vegan. So it wasn't overnight. But I will say that being the age that I am, most of my friends already have diabetes and high blood pressure. And even they can be smaller than me and way less than me, or they have higher cholesterol, and I have none of that. I'm not on any medication. So we're here as a resource if you all have any questions. I'm also a plant-based nutritionist. I studied the same thing that Dr. Fullen studied, which was the China study. So I'd be more than happy to help anyone. There's tons of other resources in the room as well. So if it's something you're interested in, just let us know here at the cafe and we'll help you, or we'll get you in touch with the right people.
It is important, even like having this meeting here today is because to bring around other people that know what you're talking about and understand what you're doing and getting support. I just want to share, if you can stand up for a moment. Sherry has gone to, is a long-time plant-based person, is very knowledgeable and helps organize these talks and other resources as well. Yes?
What about organic? And so many vegetables are not organic.
Yes.
They are genetically altered, and they have herbicides, pesticides, and fertilizers in them. And you're getting all
Glad you brought that up, because people get, so first of all, organic, whenever you look at these words, organic, first of all, there's a whole vocabulary of words that are used to confuse you and give you misinformation. Like if you look on the package, it says it's natural. Okay, that sounds good, natural. But natural doesn't mean anything. I don't know what it means, it doesn't mean anything. It doesn't mean anything in terms of health. But organic in general, and if you look at things that are certified organic by the government, it has mostly to do with regulation of what pesticides were used. And I think, personally, I like to eat organic as much as I can. I want to avoid getting all these pesticide residues. You know, and so, but that being said, when you eat whole food plant-based, that actually puts your genes in your body that makes this less likely that the carcinogens will affect you. In other words, so eating plant-based will protect you against some of those things, although I don't want to ingest them anyway. Okay? So it's better to eat organic if you can. But nothing's more powerful than eating plant-based. You mentioned GMOs. The thing about GMOs is the reason they genetically modify the plant. And most of the time they're genetically modifying it so they can use a specific pesticide. And that way the plant can tolerate that pesticide, but the other things can't. If you look at the corn that grows around here, there's like 3 plants this far apart. They're not a weed in sight. And then there's usually a sign there that says which GMO they're using. The idea is you can have these big crop yields, you know. But what you're doing is you're introducing, you're modifying genetics. You're still using a lot of pesticides in there. It's a real, I think it's a real problem. I try to avoid all GMO. And by the way, why don't companies want to label the food whether it's GMO based or not? Just label it, not even make it illegal. Because they don't want people to know that it's a GMO product. So, eat organic if you can. Plant-based will help prevent some of the side effects of the pesticides. But I think if you look at the larger issue, and I want to bring this up, I've talked a lot about the health benefits of eating this way. But if you look in the country, the way what we're doing is growing monoculture. We're only growing corn and soybeans, basically. And that's subsidized by the government. So then you grow all this corn, you have nothing to do with it, so you make high fructose corn syrup and make all this stuff, you add it to all the foods, and then people eat the foods, and then they get disease, and then the same companies make the drugs to try to prevent disease. If you think about it, the carbon emissions are very high to grow cattle this way. And very hard on the soil, because the soil is basically sterile. Because you just put all these chemicals on it, you kill all of the original organic farming. So then you grow this massive amount of cows, and as you know, they're all put in these big barns, and they're all contaminated in their own manure, cruelty to animals. So if you think about it, the reason things the way they are is related to the Congress taking money from dairy and from meat to grow these crops, to make processed foods. We end up in a food desert, you know. So you might be individually struggling with all these illnesses, but realize, you know, this is all connected to the farming policies and to the USDA policies and to the manufacturers of all these drugs. And just simply eating stuff you grow, that you can grow in your yard, simply eating, avoiding milk and dairy, and not getting all these illnesses is the cat's out of the bag now, let's just let you know. But having looked at it, you know, why is all this happening? It's all connected. Yes.
And then without the GMO labeling, how do we know what we're getting and where do you shop?
I was gonna say, seasonally, you know, when you're on this plant base, seasonally up north, where do you shop? I mean, how do you accomplish it?
Well, I grow, I have a garden that helps me, so number one, I have help. Growing as much as I can for all the reasons I mentioned, and then freezing as much as I can, canning as much as I can, trying to buy frozen when I'm buying frozen, trying to read the labels, because if you buy frozen corn and then they put a bunch of butter on top of it for you, that's not really helping you too much. But if you look, I look for like things that are single ingredient. If it's frozen corn, you look and the ingredients is corn, nothing else. Then you're better off getting the pre thing now so I've changed the way I practice. I talk about diet with everybody. Why wouldn't I? You know, that's the main treatment.
Now, I am a little concerned about soy and the correlation between breast cancer. What's confusing to me is because there are some women that have been told that cancer is caused from soy.
Yeah.
Now you look at Japan, they have a very, very, very low breast cancer rate, but they're higher plant, but they eat a lot of soy. Is the soy because of GMO, or is it because they're putting in the additives and everything? I mean, you can look at a can of tuna and there's soy in it. There's soy in everything.
There's soy in everything, and it's more of a processed soy. But soy in itself, the reason it got such a bad reputation about being associated with breast cancer is because the molecule looks like an estrogen molecule. Now, if you know anything about chemistry, looking kind of like it doesn't. It doesn't really. And there's been good evidence that eating soy reduces breast cancer. Even though you hear a lot of these concerns and you saw the books and everyone telling all kinds of things, it is hard to sort out. But my opinion is soy is fine and probably reduces breast cancer risk to eat it, even though there's plenty of people trying to do it. Yes.
I was gonna just comment on the question that she had about how do you know what's GMO and what's not?
Yes.
I usually follow the PLU stickers. If it's conventionally grown, it starts with a 3 or 4 number. It's usually 4-digit. Otherwise, the organic starts with a 9. It's a 5-digit number, and genetically modified starts with an 8. Is that right?
I think that's right. I know what you're talking about.
The little sticker on the produce. Yeah.
So 9 is fine.
9 is fine, is what I go by.
4 no more.
9 is fine.
8's not great.
Just if you would, if you could elaborate that again, because I know what you're talking about, and I'd like you to elaborate for people. They don't know what number you're
Okay, so when you go to buy produce and there's that little sticker on the, like, say, lemons that has numbers on it. Conventionally grown, which means grown with pesticides or petroleum-based pesticides, starts with a number 4 or a number 3, and it's a 4-digit number. If it's organic, it starts with 9. I usually go by 9 is fine when I'm looking at food. And it's a 5-digit number. And genetically modified has a sticker on it that has a 5-digit number 8. It starts with the number 8. So if you see a 5-digit number that starts with the number 8, you know it's genetically modified.
8's not great, 4 no more, 9 is fine.
Right.
Yeah.
Smile.
Smile. 9 is fine.
It's just very subtle.
Yeah.
Right.
That is only the way they're labeling it now, because like you say, they're not going to stamp GMO, because people won't buy it. We know
We're
that.
going to officially end it, but I'll be here to talk. Take your time, answer more questions.
Thank you.
Thank you all for coming out. Thanks again to Dr. Full, and again, we're here if you guys have any questions. Laura is the general manager here at the cafe. She also has a background in nutrition, and she's lost over 40 pounds just Laura.
And I'm the massage therapist on staff as well. Throwing that out there. Massage can help with weight loss, so if you're curious about that, please come talk to me. But yeah, 42 pounds, that's my last weight. Since September 14th.
Great.
How was it?
It was good. It was interesting. I knew a lot of information already though, so, but it's always good to
I always
get
learn something new when I attend these things. Always.
As for me, I picked out a few nuggets that I didn't know. A lot of it I already knew, but more importantly, I got a perspective from somebody else which is going to help make me a better teacher, getting others' perspectives, as well as the nuggets of new things that I learned. So it's always important to go out there seeking for the knowledge, because this is how you make the discoveries you can take action on to improve how you feel in your life. That's a pretty big
It's
deal.
great to hear these things from a surgeon or from a cardiologist. I mean, that's called backup right there.
Yeah, this is one of our dreams right here, Andrea and mine, and Kathleen's, is we want the ND and the MD communities to come together more, working in harmony, because it's going to benefit everybody, instead of MDs totally isolating themselves from anything holistic. That's just madness. And you heard that the medical doctor here is saying that medical treatment is the third leading cause of death. It just is. The third leading cause of death is medical treatment from a medical doctor. That's what he said. So the aim is to get on a plant-based whole food diet to avoid having to have medical treatment, because after all, it is the third leading cause of death. That's what the doctor said, the MD. Pretty awesome.
Eat well, live well. I lost 60 pounds.
Wow, how do you feel?
I feel fantastic. My autoimmune diseases are in remission. I feel great. I have energy. My depression is lifted. I'm living life. It's good. Diet is everything.
Way to go. Dig around on our YouTube channel, subscribe, tombergenmeyer.com, youtube.com/user/metalpalace. Do you have a YouTube channel or a website or anything? No. Well, she's Kathleen Grissom. You can find her on my Facebook. Subscribe, connect. Let's support each other.